Thank you and welcome to the show this morning. The topic this morning is the Medical Center at Duke University, and of course we have with us to talk about Lifestyle Medicine Clinic at Duke University, the director of that clinic, Dr. Eric C. Westman. And of course, Dr. Westman, let me welcome you to the show this morning.
Thank you.
And to tell you, Dr. Westman, how delighted we are to have you to have come all the way from Duke University to talk to us about what we consider to be a very, very significant program this morning, and that is Lifestyle Medicine Clinic, and about lifestyle medicine and et cetera. But before we get into that, Dr. Westman, let's see if we can have you to give us some information about your background, your education, and some of the things that were important in eventually leading you not only to Duke University, but eventually leading you to this particular show. And then we'll talk about other things.
Great. Well, it's a pleasure to be here, and thank you for your interest in this really important topic. I started as a general internist, so I went to medical school at the University of Wisconsin, worked my way south through Kentucky, saw the ravages of cigarette smoking and emphysema in Kentucky, and that got me interested in prevention, in trying to help people change their lifestyles. I went to Duke now 1990 already. That's when I came to Duke and did a fellowship in general medicine. I learned how to do clinical research, and I teamed up with the inventor of the nicotine patch. He's still there. While I was helping people quit smoking, they started gaining weight. So I became interested in people, helping them to lose weight. So actually this lifestyle medicine clinic is the combination of the research that we've done at Duke now for 17 years, which combines the best smoking cessation treatments and the best weight management treatments. You know, a funny story along the way, and it was based on my patients. You know, I want to take you back to my clinic now. I'm at the VA hospital in Durham. Okay, I'm just out of training, and I'm trying to get my patients to lose weight, and it's really frustrating for them. I sent them to my dietitians very faithfully. I was really good at that, but they weren't losing weight. So 2 patients came to me right about the same time, and they had lost 50 pounds in a couple months, and it was really interesting because I didn't know what they did. They came in, and one of them even, I remember him saying, you know, all I did is I ate steak and eggs. And I said, come on, this can't be true. And it turns out he introduced me to a diet book where one of the methods is using steak and eggs and vegetables and all that. But I was very skeptical. So I read the book against my better judgment because it did not fit in with what I was taught in medical school.
Very good.
I sent them down to the lab because I was at the hospital. I'm a doctor, and the cholesterol got better, even though they were eating more fat in the diet. In fact, they were just eating. This one man was eating steak and eggs, literally. That's all, and his cholesterol was the best it had ever been. Well,
that was a message in there somewhere.
Something was going on here, and there were 2 people at the same time, and both cholesterols got better. I went to the bookstore and looked at the different diet books on the shelf. I'd never done this before, and it turns out that the kind of the big daddy, or the one that's been around the longest, was the Atkins book. So I wrote Dr. Atkins a letter. This is now in the mid-90s. And I asked, you know, this is very interesting, can you provide me data? Yeah, I remember I'm trained in clinical trials, and I need some sort of data to hang my hat on and to use as a guide. Well, he said it was all in his book. And I said, well, that's not good enough. But he invited me to his clinic, and I looked around to the other authors who had written diet books, and they didn't have clinics. I tried to embrace this and venture out and scout, sort of, but Dr. Atkins invited me. And it was really interesting because despite what you'd heard all around and what you saw on TV, the diet was working, and it worked very well. So I sat in his office, I sat in his nurse, Jackie Eberstein's office. They were happy to have me come. We went home with a check to do a study. And the first study was so interesting, we did a second study, which was a controlled trial. And the science really has progressed now such that you may have heard just in the first half of this year, there are now 2 or 3 studies, one of them in JAMA, that says that a low-carb diet is a really good thing to do. Now, we didn't know it back then, but so that's how I got involved in weight management. And not everyone has that story. Along the way, I met the people at the American Society of Bariatric Physicians. That's the weight management organization for the United States, and they've taught me a lot, and I'm a part of that organization now, and this is so important now.
And of course, Doctor, we'll pick up on that organization as soon as we make our first commercial break, and then we'll come back and pick up at that point. And we'll be back with our audience following this very, very short commercial break.